والسلام على سيدنا محمد وعلى آله وصحبه وسلم أجمعين. It is a great pleasure for me and for every family physician today to celebrate World Family Doctor Day. World Organization of Family Doctors observes Family Doctor Day on 19th of May every year. This day becomes a day to highlight the role and contributions of family doctor in healthcare system around the world. All my greeting appreciation to all family doctor in the Eastern Mediterranean region and all over the world. You are the gatekeeper of health service. You are the frontline fighter. You are our way to safe future. Together we can build a stronger health system and achieve our regional vision of health for all by all. Continue with your work at the same time, stay well. Thanks for your attendance. Thanks for Professor Wagida Anwar, the head of the Specialized Federation Health System Improvement NGOs. Thanks for Professor Nesreen Al-Nimr, High Institute of Health, Alexandria. Thanks very much. And
thank you, Doctor.
Appreciation for you, Nagwa, for your effort and your activity. Thank you very much. You are all welcome.
Thank you so much, Prof. Tagreed, for this introductory welcome. And then we are going to go to Prof. Wagida Anwar to hear her introductory about this day. Dr. Wagida.
Good evening. I would like to say that I'm very grateful and happy to be with you today, and thank you, Dr. Tagreed, for inviting me. It's my great pleasure, and thank you for your great effort to support the family physician for a long time, not only as a university professor, but also your contribution in the Egyptian Fellowship and also at the Ministry of Health, and through your leadership for the Egyptian Society for Family Physician. Your students are, all over the country, and you are a leader and the godmother for the family physician in Egypt.
Thank you, Dr. Wagid.
And your society is a founder for the Specialized Federation for Health System Improvement, and we hope that this Specialized Federation will have a role in improving the health system in Egypt together with the government. The family physician is the gatekeeper for the health system, for the referral system from primary, secondary, and tertiary health care. And we have now in Egypt the universal health coverage law, and for the first time the family doctor is as I said, is the gatekeeper for the system. So they have a great role in implementing the universal health coverage to assure health care for everyone in his place without suffering from financial problems and so on. So I wish you very good luck in your effort, and we hope we keep the cooperation to improve the role of family physician all over the region and all over the world, I hope. Thank you. Good luck.
Thank you so much. Thank you so much, Prof. Wagida. Today we are here together so as to celebrate the World Wonka Family Doctor Day. There are 4 pillars for the World Wonka Family Doctor Day. They are building the future with family physicians and the primary care team, building the future with family physician and the patients, building the future with family physicians and the new technology, building the future with family physicians and you. And we had chosen vaccine, post-COVID, chosen COVID-19 vaccination merits and demerits of the vaccination in order to help each one of you to decide that this is better for all of us, for ourselves, for the healthcare system, for the healthcare team, for the patients, and for you. And we're going to have Prof. Nesreen Nemr from the Alexandria Higher Institute of Health is going to talk to us about merits and demerits of COVID-19 vaccination. Prof. Nesreen.
Okay, thank you. Good evening, everyone. First, I would like to thank Dr. Taghareed and Dr. Ragwa for their kind invitation to share the activities of this great day. Today, I'll be talking about the merits and demerits of COVID vaccine. I'm Dr. Nesreen Nemr. I'm a professor of epidemiology at the High Institute of Public Health, Alexandria University. Okay. In this presentation, I'll try to answer 3 questions. Do we need vaccines for COVID-19? Does the COVID-19 accelerated development timeline affect its safety? And what is the best COVID-19 vaccine? What do we know so far? The COVID-19 pandemic is the greatest challenge we have faced since World War II. The pandemic has globally caused devastating effect on lives, causing massive disruption to families, societies, and for the economy. Safe and effective vaccines are game changers and an important tool in stopping the pandemic. Many vaccines have been authorized around the globe and many more remain in development. Well, it's not vaccines that will stop the pandemic, it's vaccination. Since the start of the pandemic, and efforts have been collaborated between different manufacturers to develop vaccines, and vaccine hesitancy has been noticed around the globe. And people were starting to ask questions regarding the safety of the vaccines, their efficacy, their side effects, and their cost. Among the factors contributing to the vaccine hesitancy is the accelerated development of these vaccines, the novelty of the platforms used, and the misinformation spread through multiple channels. So first, do we need vaccines for COVID-19? In general, vaccines are among the most cost-effective interventions available. Vaccination currently saves between 2 to 3 million lives every year. In addition, community vaccination protects the whole community, even those who cannot be vaccinated. Talking about COVID-19, vaccines can only be of value when the uptake in the general population is sufficiently high, and we are talking about 70%. Vaccines also have disadvantages over natural infection because sometimes the price paid for immunity after natural infection is very high. For vaccines, the dose of exposure is carefully measured or carefully calculated, and so it can produce the best immunologic response with minimal side effects. Also, few vaccines induce even a better immune response than natural infections. Specifically talking about COVID-19 vaccines, we need these vaccines to reduce death and disease, especially among older adults and those with comorbidities, to protect essential services, especially healthcare workers, and to reduce societal and economic disruption. We need students to maintain education, and we need to protect those who cannot work from home. And speaking of economic disruption, vaccination could avert direct medical costs and productivity losses. A COVID vaccine can reduce the need, which reduces the need for physical distancing and lockdowns, and can restore economic activity, have suggested a high societal value. And delivering vaccine to low-income countries has been estimated to yield an almost 5-fold return on investment. Second question, does the COVID-19 accelerated vaccine development timeline affect its safety? Well, the traditional vaccine development timeline passes through several phases, and this could take from 5 to 10 years and even longer. To accelerate the COVID-19 vaccine development, the steps are done in parallel and not sequential, keeping all usual safety and efficacy monitoring mechanisms in place. In addition to being conducted in parallel, other factors that helped this accelerated development, that the genetic sequence was established very early using decade-old technology, governmental support and funding for rapid development, advanced production of millions of doses while the clinical trials were still underway, distribution logistics were pre-planned, and there was collaboration and cooperation between manufacturers. Ways by which scientists are ensuring the safety of COVID-19 vaccines include that safety is investigated at every stage in vaccine development. They are monitored after clinical trial. There is a global consensus on adverse events relevant to the COVID-19 vaccines. There is a surveillance to determine background rates of adverse events and developing a vaccine safety profile. Last question, what is the best COVID-19 vaccine? Well, to answer this question, let's first decide about the criteria of an ideal COVID-19 vaccine. An ideal COVID vaccine needs to be safe, easily stored and transported, confer long-lasting protection, prevent virus transmission, given in a single dose, easily administered, and produced quickly in large quantities. Well, there are several platforms that are used for the development of COVID vaccines, including traditional platforms like the inactivated, live attenuated, and protein subunits, and other platforms like viral vector vaccines and the novel nucleic acid vaccines, DNA and RNA vaccines. In this presentation, I'll focus on the platforms for which licensed vaccines are already available. Namely inactivated vaccines, viral vector vaccines, and RNA vaccines. First, inactivated vaccines, it uses an inactivated virus, which is inactivated using either heat or a chemical, and this inactivated virus is used as an immunogen. We have several licensed vaccines using this platform, which have been used before in human population. We have the viral vector vaccines in which viruses, especially the adenovirus, is used for encoding for the SARS-CoV-2 antigen. And then when the virus enters the host cell, it can be transcribed into the spike protein. Finally, we have the RNA vaccines, where RNA encoding the spike protein of the SARS-CoV-2 is taken by the host cells and then is translated, inducing an immune response towards this antigen. Advantages of inactivated vaccines, including being a well-established technology, providing strong immune response, it's suitable for immune-compromised, and it's easily stored and transported. But on the other hand, they require booster shots. Scale-up manufacturing seems to be hard, and they are relatively expensive. Examples of COVID vaccines produced through this platform, including the Sinopharm and Sinovac vaccines. Viral vector vaccines, also a well-established technology. It produces strong immune response, both cellular and humoral, could be given in a one dose, easily stored and transported. But the main disadvantage is the host may possess immunity against the vector due to prior exposure, and so this could reduce the efficacy of the vaccine. Examples of COVID vaccines produced using this technology, the Oxford AstraZeneca vaccine, the Sputnik V vaccine, and Johnson & Johnson vaccine. As for the RNA vaccines, it gives strong immune response. There is no risk of integration into the host genome. Scaling up to global-wide production appears to be feasible, and actually we have 10 years of experience with this technology with other vaccines. But despite this experience, no approved RNA vaccines in humans are available, and some of these vaccines require ultra-cold storage. Of course, examples of RNA vaccines, the Pfizer-BioNTech vaccine and Moderna vaccine. Okay, so if you want to compare some of the merits and demerits of some of these available vaccines, let's say that all of, namely, let's talk about Sinopharm, Pfizer-BioNTech, Moderna, Oxford AstraZeneca, Sinovac, Johnson & Johnson, and Sputnik V. All these vaccines rely on well-established technology, except for Pfizer and Moderna, in which we don't have any human licensed vaccines using RNA platform. All of these vaccines are given in 2 doses, except for Johnson & Johnson, it's given in 1 dose. They all produce protection against COVID-19, and it varies from about 95% for Pfizer, BioNTech, and Moderna, 91% for Sputnik V. AstraZeneca, it ranges from 62 to 90% with an average of 70%. We have Sinopharm, about 79.3%, and Johnson & Johnson, 66.9%, and Sinovac, about 50%. Well, an important question, what about the effectiveness against the variants? We don't have available data yet for the efficacy of these vaccines against the different variables, but it has been reported that Pfizer, BioNTech, and AstraZeneca vaccines seems to be effective against the UK strain, while the Johnson & Johnson vaccine appears to be effective against the South Africa strain and the Brazil strain, but still more data are needed. All of these vaccines are stored in the regular temperature from 2 to 8 degrees centigrade, except for Pfizer, BioNTech, and Moderna, which require cold storage, ultra cold storage at -70 and -20 degrees. All the vaccines are recommended for adults 18 years and above, except for Pfizer, BioNTech, which is given for people 16 years and above. And now in the USA, they are starting to give Pfizer, BioNTech for children 12 years and above. AstraZeneca, there is variation in some countries about the age group for which these vaccines are given. Safety concerns, there have been safety concerns regarding AstraZeneca and Johnson & Johnson vaccine